It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome everyone to the Sam Lesante Show, a special show I have here today, my friends. You're going to like this show. We're going to talk about a little bit about our past, what we've done here at Samson Productions, and the great people we have working with us. It's really a pleasure to have Dr. Benyo, Philip Benyo, and his lovely wife, Dr. Kathleen Benyo, on the show today to talk about a little bit of a history, okay? And incidentally, thank you for making It's Your Health #1 health show in Northeastern Pennsylvania. Welcome.
Thank you.
It's so nice to have the both of you on the show. I mean, I feel honored to have the stars of It's Your Health on the show. It's great.
Sam, it's our pleasure to increase your ratings.
Keep it up. Keep it up. Let's go back in history a little bit, Philip. Okay, you know, we started back in 1994, as you know, with Samson Productions. At that particular point in time, you know, I had a vision of what local neighborhood programming should be. I worked for a long time to get it, and finally we were able to get it on the air. But one of the things that I've always was concerned about is the health care. There are a lot of people that just don't get to the doctors the way they should, etc. So we established back then, over 30 years ago, a segment, which was It's Your Health segment, and you were doing that segment. It went so well that we developed it into a half-hour show, which is It's Your Health, which is going right now. What were your thoughts when we were doing that show?
Well, it was innovative. In fact, we took live phone calls, and one show had someone calling in with chest pain, and we said, you know, you got to go to the emergency room, and they ended up having a cardiac issue. So it really was on the fly, if you will. And then it developed and morphed into preventative care and trying to bring patients up to snuff as to what's going on out there.
How did you, as a doctor at that time, envision the show, Phil?
I kind of thought it was going to be one and done. I didn't think it would grow. But let's look at the record. Sam Lesante and SSPTV has grown remarkably over the years. So we just kind of hitched our caboose to that train that you're driving.
When we started the show, It's Your Health, you know, we had objectives, okay? Did this come from your patients, knowing what is needed out there, or how did you get that information? And
again, we sort of had our finger on the pulse of the community and what the community was interested in. At that time, I was working at St. Joseph's, doing emergency room ambulatory care work, which then morphed into private practice. And so we kind of had a feel, especially growing up in the area, what the needs were.
Working with Dave Thomas, you know, he worked well, and then of course Rick Marticelli worked well. Then you brought your son on. What was the transition there?
Well, having my son work and follow in my footsteps with medicine was such a privilege. Just like you, Sam, have your boy, and the apple doesn't fall far from the tree. You know, he's learning from the best. Thank
you for that. When you look at the needs of our community, okay, and the needs, you know, where do you see health care? You know, when you're doing your shows now, and we're going to get to Kathleen, who is the brains behind the outfit here, okay? And they love you, Kathleen, and I mean that sincerely, because you're sincere and you're honest what you're doing. How do you address the need for health care in this area?
Yeah, great question, Sam. I think we've kind of changed a little bit from medicine being eye to eye, face to face, to now I'm looking at a computer screen, and it gets a little disingenuous, if you will, less personal. And so we try to maintain that we're dealing with personalities that are from the community, and we share those same values. Screening is what's key, because no one wants to go for a test for which they have no symptoms. They don't want to take medications for which they have no symptoms. But these are the key issues, because what takes us out is stroke and heart attack and cancer. And we can screen and control and lower the risks of those problems before they become bigger problems. And you know, Sam, people take better care of their cars. They put the best oil, the best gasoline, and what do? We don't have the best of food. We smoke things that our lungs are not designed for. You know, if I told you to go out and put your mouth on an exhaust pipe and start breathing it, you'd say there's no way I'm doing that. but using tobacco products is worse than that, believe it or not. So our bodies are temples, if you will, and we need to respect them and take care of them.
Kathleen, after, his doing all these shows, okay, and we shared a little bit how our health shows, I'm happy when the people say we're the health station, because we have all these doctors coming on, and not only doctors, but PAs and the whole bit. What were your thoughts, okay, before you got involved with the show with your husband?
I just loved watching it because it was so interesting. It was fun. They made it funny, and they made it helpful to the people watching. So I enjoyed it.
How do you determine, what issues you bring up at the show?
I'd like to take credit, but I can't, because Philip rows the boat. He determines what we're going to cover, and then we divide that up, who's going to do what part, but he's really the impetus behind the show.
Women issues. Okay, there's a lot of women out there that have issues. A lot of men have issues, but primarily, you addressed, menopause, you addressed the concerns, okay? And you do it in a nice way. You do it in a way, but sometimes men don't understand, okay? How much information do you think, is needed out there for women to get mammograms, to go and get tested, et cetera, and what you're talking about? And how many lives you think you could save?
I have no idea how many lives I could save, but the more information we distribute, we provide, whether through a doctor, through It's Your Health, or whatever means, does nothing but helps women. It's always valuable.
Phil, in doing this show, and you have your patients coming in, I know I've experienced this where people come up and tell me, thanks for having this, et cetera. Have you had any, patients or people come in saying, boy, doctor, I'm glad you brought this up, because I had this, or my wife or my friends or my relatives, et cetera, from the show?
There's no doubt, wherever we go, we run into people who say, hey, I saw it on It's Your Health, and you helped us in some way, shape, or form. And I think just getting the message out there that we need to take care of ourselves, because let's face it, Sam, we grew up in a time where there was respect and faith. I know that sounds old school, but old school was working. And with that, we had certain values where we took care of ourselves. And today I'm finding situations where we're coming last in terms of our health, where we should be coming first. It's out there that this country is lacking other countries in terms of its health status, and it shouldn't be. We should be the first. And so trying to champion screening for cancer, for example, and taking care of our bodies, that's paramount. We may not know the result of that tomorrow or the next month or so, but we're going to know it years from now.
How do you encourage that person, okay, that, I'm going to get around to it, it's a good idea, okay? How do you encourage that person to get out?
Right. Well, the computer does help in some regard. Is we have these things called metrics that show up on our sidebar of the computer. When I'm seeing you, it says Sam is due for a colonoscopy. Sam is due for a blood test. Sam is due for this or that, immunizations. So that we kind of get prompted, and we show black on white, hey, listen, here's your matrix, and these are the things that we recommend for you. And people see that on the computer screen, and they can somehow buy into it and say, well, I'll do it.
Kathleen, what are some of the key issues now in women's? What would you highly recommend?
Well, definitely a colonoscopy, whether you're male or female, regular blood tests, breast exams, all of the typical stuff you want to be careful about.
What about ages? Okay, when is,
Well, my mom always said to me, wait till you get old, it's living hell. But luckily she hasn't been quite right, because my age has really been good to me so far. But I think we have to be convinced that as we get older, our body changes, and we have to consider that. We have to think about things we don't want to think about, like our weight, how our skin is aging, we're getting wrinkles, and how do we deal with that? But even the more serious ones like breast cancer, just the typical ones that we hear all the time from the doctor. We need to follow what he says. When you see him and he says, you need this, this, and this, you need not to put it off.
But what I also found, Phil, in my years of doing the show and interviewing a lot of doctors, is that bedside manner, the compassion, and it's very difficult. It's like being a priest. You're dealing with a person who's getting married and they're excited, then you're dealing with a person who just, the loved one died, and that priest has to adjust, a minister, a rabbi has to adjust. That must be very, you're a human too, and you have feelings and you have emotions. I can't imagine how many times you came home and just bared it out on Kathleen and saying, I had this today and I had that. Sometimes they don't think you're human. How does that affect you?
Well, we've always been taught that there's the art and the science of medicine. The science is cut and dry. The art is something that is learned, and it's part of what we call empathy. And empathy is very taxing. That means I put myself in that patient's shoes, and I try to experience the feelings that they're going through. Whether it's a birth or a death or something in between, that is taxing. And it's taxing on Kathleen as well, because she'll hear me on the phone talking to a perfect stranger about entering hospice services and how it's difficult transitioning from this life to the next. And I get off the phone after I'm telling the patient, virtual hug going your way, and she says, you don't hug me.
Oh, tell me about it. Yeah, isn't that the truth? Yeah.
But what's interesting, Sam, is that if you look at the statistics, almost 80% of the Medicare expenditures that you will spend in your life come your last 2 years of life. Why is that? That's because these silent diseases are silent until they're not. And then we throw the book at you for things that could have been found earlier. So 80% of the Medicare expenditures, your last 2 years of life, shouldn't be that. It should be the other way around.
Folks, I'm talking to Dr. Phil Benyo and his lovely wife, Kathleen Benyo. You see them every day on At Your Health. And remember, you can get our full schedule of all the shows we have in the panorama. We'll be back right after this. Well, welcome back to the Sam Lesante Show. Remember, 24/7 SSPTV.com. All of our shows are there on our YouTube channel and Facebook as well. We run all the shows there. If you don't have cable, which you should, we're there for you. I'm doing a great show today. We produce a lot of shows. Started back in 1994, and one of the shows I'm glad I produced is It's Your Health. And I have the key stars of that show, Dr. Philip Benyo and Dr. Kathleen Benyo. Now, your doctor's degree is in education, right?
Yes.
Yeah. That must have been an experience for you, huh?
It's a lot like healthcare, because over the years it changed so much. Just like healthcare changed so much, so did education. And I thoroughly enjoyed it, especially the students the most.
Did you enjoy the changes?
Well, I didn't enjoy when it got near the end of my time, when we started locking all the doors, carrying walkie-talkies, checking everybody who tried to come in, didn't let them in without a facial recognition. It got hard.
You have 12 grandchildren, and you shared an interesting story with me, and we just did a show up at Mountain City Nursing, which was a great show, and I should have used your story. Tell me the story about your grandson.
Well, one of the reasons my children my two boys have walked in my shoes and are taking up medicine, practicing with me, is when they were in the formative years, I would take them around with me to do house calls to the nursing homes, and they got to see what many don't. And last year, my eldest grandson said, "Pop, I'd like to kind of see what you do." And so I took him along to the nursing home, where he saw some of the patients that are not going to leave the nursing home. And it was around the holiday season, Sam, and he came out saying, Pop, you know, these people look lonely. There's nobody visiting them. There's no family. And what he did was went back to his MMI and proposed a program where students can adopt a nursing home patient, if you will, for lack of a better word, and visit them on a regular basis. And for example, he told me the last time he was there, he was playing blackjack with one of the residents. And so it's one hand washes the other. You have a patient who feels that there's someone out there who cares for them, and youngsters get to see some things in life that they would not have been exposed to.
And it's so true because, thank God the assisted living homes and nursing, they have activities. You know, if they didn't have these activities, you know, and some people just neglect their family or their friends, and it'd be so nice to drop in and just someone to see, you know. You don't realize how lonely it could be, you know, working with those things.
Socialization is a key medicine. Absolutely, no side effects. When you have socialization, you are going to have a decrease in mental decline and other health factor benefits as well.
We know compassion is very important, what we're doing. For those people, Kathleen, that have health issues or are like me, you know, not afraid, but just not thrilled about going to see a doctor. I do go, but however, reluctantly sometimes. What encouragement do you give them, you know?
I think the first thing I would tell them is not to believe everything they read on the internet. I think they have to look towards finding somebody to give them some basic necessary information rather than buying or building whatever they see on the internet.
That's another thing I'm going to ask you. You know, you see these commercials, okay, that are, you know, for energy, take this pill. For, you know, for aches and pains, put this on, okay, and this will, you know, and you have all these different vitamins and different things that you see on TV, and, you know, and after 10 days, you won't have any more back pain, etc. You know,
I have an answer for that.
what is it?
When as soon as it comes on TV, I say to him, does this work? And then I know.
That's because you have him next to you.
That's right.
But a lot of people at home saying, you know, my back is hurting me, and they're telling me that they see a guy dancing and they're playing, you know. What do you have to say for that?
I say you have to look at a country like Sicily or Italy. I have patients that have visited there, as well as family and friends. They say they wake up in the morning after a great night's sleep. They don't know what they're going to have for breakfast, so they go out and they get fresh, whatever it is they're going to do, and they make it on the spot. They walk to these places. There's less stress in their life. They're eating off the land, a Mediterranean diet, if you will. It is so basic. We should be able to live to 100. You know, Confucius said life is simple, but we make it complicated.
Isn't it the truth?
And so all you have to do is eat right, exercise a little, and guess what? You own the world.
You know, it's interesting, Phil and Kathleen, how much stress we put on ourselves sometimes. And so, you know, I see so much people making mountains out of molehills, and they bring the stress on themselves, okay? And it's just like, you know, nonsensical things. You know, do you see that, Kathleen?
Sure. I think that's human nature, that to tend to do that, but we have to be able to look past it, to take a deep breath and to deal with it, you know, instead of letting it build inside of us.
How much of a detriment to the human body is putting stress on yourself, Philip?
Again,
I know that answer.
I can go back to the car. You know, a car can go 40, 50 miles an hour forever, but they have red lines on the speedometers. You're not supposed to go past certain RPMs because that stresses the engine and all the body parts. Our body is no different, or no different. And again, I go back to, we lived in a time where there was respect and faith. Today, it is lacking, and what has taken its place? Anger anger is like rust in our bodies and stress.
Do you know where I see it? Drivers. I hate driving because there are so many angry drivers who are speeding around and not stopping at stop signs and red lights. It's exactly what you say.
I have a decal I'm putting on the back of my car. It says, "Do you follow Jesus as closely as me?"
You know, it's interesting, Kathleen. I went for my yearly exam, and Philip comes in the room, and you know, we go over, checks my blood pressure, etc. And he looks at me and he says, "You know, Sam, don't we live in a troubled world today?" He said, "You know, it's just like it's, you know, and that sort of like, you know, we live in a troubled world because we make it the troubled world. You know, we live in a, you know, and you talk about faith, and it's so sad that, you know, and whether I'm Catholic, Protestant, Jewish, whatever, you know, I go to church at St. John Bosco, but I look around and say, you know, what people are missing, not having their faith anymore. There's a lot of people there, but you know, I think it's so important to have some kind of faith. Wouldn't you agree, Philip?
Well, it was old school, Sam, and old school worked because we lived it. What's happening now is not working.
No. Do you see that as well, Kathleen? Mm-hmm. And I remember me you saying, Sam, you know, it's, we sometimes we had a magic wand, you know, but it's so nice having the both of you on the show.
Thank you.
And just to talk about, you know, you are a human being as we all are, and you know, congratulations to the success of your show. Keep the good work up, Philip.
And you know, truth be told, when she first kind of volunteered for this, I said,
He needed somebody.
"No, I don't think so,
He
Kathleen."
said no. He said no, I couldn't do it.
Oh, guess what? You make the show, Kathleen. That's why I'm keeping the show on.
Oh, okay.
Okay.
It's
And
good
then, of
to
course,
know.
you know, he won't even fix up my exams. I say, here's $50 change. That he won't do
No.
that. No. All kidding aside, Philip, it's so I'm honored to have you as our doctor, and you've been there. I hope you're around for another 30, 40 years. And so nice to see you, Kathleen.
Thank you, Sam.
Keep the good work up. It's on every day. It's called It's Your Health, my friends. And let me tell you, just go to our website. There's a lot of great shows that they've done. We showed you some clips as we're talking to Philip, Dr. Benyo. But there's a lot of great shows, a lot of great information. So a lot of you go back and, you know, just hit the shows, hit It's Your Health, and go back and see all the different shows. You'll even see the shows with Dave Thomas and Rick Marticelli. Remember, 24/7, SSPTV.com. You get all of our shows, and our full schedule is in the panorama. We'll see you next time.